So this session, this session and the next one are, I think, extremely important. And the reason is that now we have discussed certain things, but now we want to understand from you what is happening in the region. So it's a very vast region that we're talking about. We're talking about the Asian continent, the whole of it, and then the Australian continent, and then there are countries with different levels of development, both in terms of economic, but also the health level developments are different. So we need to understand. I think we need to understand what's going on, what we think are the regional issues, what we think are the priorities. So once we have stated them down, I think then only we can start thinking of how to address them as well. So it's a brainstorming session. So we are not having any lectures or anything. So, but I want all of you to please, uh, contribute, participate in this session. So I need somebody's help who could help me here. Maybe write on that flip chart whatever we are, discussing. So anybody who could help? Hello, anybody, please? All right, thank you very much. Yeah. So we have the marker there. So I want. So let's start. What do you think is the issue number one in the region, or at least in your region? What is the issue number one? Let's discuss. Anybody starting? Yes, please. Yes, Makia. Sorry. Yeah. So we have no. Yeah. So we have no roadmap available. Yeah. Yes, Lou, please.
Healthcare inequality. So, for example, for instance, in China, if you live in an urban area, if you take the biologics, you only need to pay $10 per month for an injection. But for many rural areas in China, they never heard about the biologics. That's the inequality of treatment and healthcare.
So inequality or
Of healthcare system.
okay, this inequality. So within same countries, with the same areas, there are different levels of healthcare that's provided. Okay, that's important. Yes, Eugenie.
One of the problems that I've definitely noticed is misinformation and disinformation, lack of knowledge and wrong knowledge. That stops people from getting the right type of education.
Right. So I think let's also maybe let's also discuss the problems, but maybe if you think there are some solutions to what you're saying, so that it will help us, as an organization. All right, these are the issues. How can we address them? So if you think there is an issue with the education capacity building or knowledge base or whatever, what do you think could be the solution to that?
And solutions that I think most certainly recommend is patient voice. The patient voice can be incorporated into dissemination of knowledge. Because in the context of pain, a lot of patients tend to rely on clinicians' knowledge. But clinicians also don't have enough knowledge about the latest research of pain. So if researchers or clinicians can respect patients' voice and incorporate their experience, I think we can speed up disseminating right type of knowledge much better. It comes with respect. Patient's voice needs to be respected. But before it can be respected, their experience must be believed first. people don't believe, especially when it comes to pain. Pain is invisible.
Hmm.
There is no biomarkers. There is no evidence-based heart such thing as screening, fMRI, X-rays. None of those screenings show that you're experiencing pain. So, only way for people to communicate their pain is to believe them. But to believe them, for some reason this can be one of our hardest things. So it needs to start from there.
So patients are not listened to. Would that be the right word, maybe?
Not listen to and not believe.
For both things. Okay.
And the barriers could be because of the prejudice. It could be based on racism, sexism, ageism. It could be any
So discrimination,
bias.
biases and discrimination as well, issues. Haris, over there.
Is that every combination with not just our patients, but our patients in the system here and then, is that in the training of our medical practitioners, our GPs, there is very little, almost no education on particular disease states. With psoriasis, there is about 4 hours training in the 5-year program of any skin disorders. Most, because it's Australia, most people understand melanoma because people know. You can also die from the aspects of particular condition as well. Nobody knows about that. So the first step is how do we increase our GP's knowledge on not just ask but all skin conditions, so that when somebody presents to their clinic, they have an understanding of what is in front of them. Our next system is a referral process. You cannot go directly to a specialist, you have to see the GP. So if they don't get to see the specialist, you can then treat you for your condition. The other part of that, the other sort of bottleneck that we see is the restriction of the amount of specialists for a particular field. So we have about 25 million people in Australia, that's about right. We have 618 dermatologists for the entire country. So access to care there, it's just really, really basic. So how we've tried with the white paper to government to see about getting more support funding for getting specialists, getting doctors to be able to go in specialty areas. And then we could have about 300 applications across trainee doctors to be dermatologists, but we will probably only have 4 that will actually pass the boards. So that's the other bottleneck. So it's not even money. It's like it's education at the basic level, and then it is how do we not necessarily stop them, but how can we stop those restrictive pillars of care and get them to broaden the amount of people. 3 people so far this month that are living in the country and only probably about 2 or 3 hours from Melbourne and the same in Sydney. And they have no way, they're in a really bad state, and they have no way of getting into a doctor because although the doctors that will do a regional run have decided it's too hard, it's too expensive now with the cost of fuel and everything. So they are stopping doing their regional runs. So now it's 18 months to 2 years for somebody in the country to come to the city and see a specialist, or I'm looking at a way of maybe raising money so that we can provide a patient transport vehicle and maybe go and collect them and bring them in to the city. So these are so-called affluent countries, but we have some really, really basic restrictions and needs, but not just our particular condition, but really any condition.
So basically, we're talking about two things here. One is the lack of education of the healthcare providers, their expertise, and the other one is access. Basically, that's again, an issue. So, do you have any suggestions? So, as you know, the suggestion is not for the government of Australia. Is the suggestion is for us as patient advocate. What can we do? As an organization, as a group, as a network, how can we contribute?
Well, I did find that I did find out that the Skin Health Institute, they run a GP education program. In a bit pricey, but they didn't do it with their Zoom or teleconferencing. It was like face to face, and you probably do 30 or 40 GPs. I'm trying to work out a way or a prospectus or a way of going to them and pharma and that to help fund. That if we created it, that it was more online, get us the data points, and that we could perhaps train, in one session 1,000 or 1,500 or whatever it is, GPs at the one time. So that would also help to manage some of the regional care. And the other thing I was looking at was if I could start a similar project for nurse practitioners, so that if doctors, the GPs don't have time, at least there would be someone with medical background training in city and regional areas who would be able to start the process of referral. So would get their time with diagnosis and then start the road to access to treatment.
Okay, yeah. I think I've also done that, because when there's nobody to train the healthcare providers, then the patient organization themselves have to step forward and work with the other, qualified healthcare providers and develop a training program and get it delivered. So I think that's the right thing to do if nobody else is doing it. State of shock.
And a little bit more collaboration with us. And
Right.
that, because we're supposed to all be on the same point and helping patients get care.
Right. Yes, Lami.
I was thinking about the session pattern, which is healthcare issues based by the region, and then thought maybe something relevant. But based on the discussion that the colleagues made, we need to come up with the healthcare issue that the World Patient Alliance can help in or provide support if possible. So I have a list here, but I would like to focus on two. So one of the things that we consider just realize or observe is that patients don't believe it themselves. They think that we are just receivers, and we just want to go to the hospital to see the care and then just leave. So I think one of the things that we work on in Ethiopia, and I think the support of the World Patient Alliance can be is raising the awareness that you are a partner. You are not only a receiver. So this message is not delivered 100%. It is delivered, but maybe in our close circle, but in all levels. And this follows with the other point, which is reporting. Patients believe that reporting should be only from the healthcare provider side.
Right.
So even if they don't have a platform, they need to know that the reporting is not only through a system and the website and the a web page. It's only by going to the healthcare institution in any department and report something that you might or you believe that will prevent this error from happening in the future. So maybe those two things, which sum up with the suggestion or solution of raising the awareness and delivering the message and
Right.
revising.
So awareness on patient rights, I think that's very important so that people understand what their rights are and also the responsibility. So that's one thing. And what's how would you categorize the other one?
The other one also raising the awareness that you have a role to participate in preventing medical errors or, as we call it, adverse events from happening or even mitigating the risk.
So reporting the adverse events, and I think patient safety itself is, I think, an important issue within our region. I think that really needs addressing at every level, by the government, by the patient organizations, by the healthcare providers at all levels.
So it's not entirely wrong to provide the message, which is you have a role, participate, activate your role. Not only patient advocates like our colleagues today, but even individuals, community. So this is what I would like to share.
Yeah. Okay. Anybody else? Dr. Ken first.
Thank you. I have a few things. One is the health literacy. I think the whole our colleagues already mentioned. So that
health literacy. Yeah.
Second thing is language. English is our common language to talk to each other. However, in Asia, Japan, patients, family members are not good at to communicate in English. So that's a kind of big barrier.
Language barriers.
I was surprised to see that so many colleagues from our region sharing a lot of stories and activities. So if people can understand English, there are a lot of activities, they will be very encouraged and empowered. So I guess it's a bit different aspect. I mean, the aspect, but I think English language is one of the barriers for us to expand our activities and to partner in the partners.
So, what would you suggest? Just a second. What would you suggest? How many languages should we maybe try to? Because there's so many languages, it's impossible to have every language. But maybe we can work toward maybe 2 languages or 3. So,
but English is okay. Fortunately, nowadays the machinery authorized translation.
Yeah.
So I have both.
AI.
Yeah, we can utilize the ICT technology to communicate the clients. That's one of the options.
Yeah. So, just for my own information, so we've come to know about this online. It's an online platform of AI simultaneous translation. So if some event is happening, it's doing simultaneous translation. But is there anything else that helps in translation of your emails and your newsletter or your website and all of those things? Does anybody know if there is any such thing exist? Just a second. We have Eugene first, and then we come back to you. If there is any, do let me know, because I couldn't find a good reliable translation service. Yes, Eugene.
Education from different perspectives. So, for instance, patients. Like one of the speakers mentioned that we need to take responsibility. We need to be educated. I'll give you an example. All the generations, Korean older generations, and I'm sure it's like there's no longer Asian countries as well, they would like to get their money back. I mean, they would like to get their money's worth when they go to the hospital. So one of the common ways for them to feel like, after care is that when doctors do lots of it doesn't really matter what these medications do. they would like to see something to swallow. It just makes them feel like I'm doing it. It doesn't really matter what the doctors prescribe to you, what these medications can do, what these combinations of certain medications can do to you, it could be harmful. It doesn't really matter, they just want to have off the medication. So they need to be educated, especially when it comes to pain and when it comes to chronic or persistent, there is no single medication for multiple medications that will safely do the treatment of it. There is no such medication. But pain is not biomechanical. It is biosocial, psychic. If we don't get educated on our social factors and psychological factors as well as biological factors, there's no such thing that we won't be able to get in the right amount of treatment. So we need to be educated. Secondly, the education must go towards the patients. Clinicians also need to be informed with cultural safety, trauma-informed approach, all the other factors that they don't necessarily learn from the news. That they also need to understand that pain is not by the side of fire or a lot of disease are not really isolated as biomedical. There are so many other factors. And one of the best ways for them to treat patients sensitively, respectfully, is for them to get some training. And everyday training is not necessarily that they don't prioritize in a university training. It has to come as an extra education from all different ends must be included. And also social factors. Even if you don't call yourself patient, what about your family, your friends, your colleagues, the way they treat you, the way they question you with your own experience, factor into the way you experience your group. The public also needs to be educated.
Thank you. And there's one comment online as well, and it's been highlighted by Abdul Rashid from Pakistan, and he says that the irrational prescribing and irrational use of medicines is also a big problem in this region. The other one is talking about that there's no data available on many of those things available in the data. I think that's also an important issue, that we do not have much data available for our advocacy work as well, and also for the understanding of what actually is happening on the ground. So can I?
Yes.
Thank you. Well, I think the healthcare issues problem faces in Vietnam. I think in some other countries, our resource, we have first. I tell you that the insurance of medical insurance now in Vietnam, we have only government. We don't have private company. So insurance after the government insurance cannot cover all. And that's why it's least of the medicine the people receive not enough. And for the biological treatment, we pay a lot of money. So I think that not about the 1% of the people living in society can access. It's the big problem with I think the economic about the payment. just last 2 weeks, I think the years of 2004, we are going to focus is how much money you spend on your children. This is very big problem. The second,
So just as healthcare financing affordability, that's one thing. I think.
the second is, you see that not everybody can access right. I can say that all the good doctors stay in the cities. People are living in the remote area like that, far away. We have doctors, but not right doctors. I can say that because it's a big problem, right? And if you cannot find the right doctors and cannot fit the right time, so it's a very, very big problem. Second one. Because people are going to the the local doctors, but it's not doctor at all, but they use a medical, traditional like herb, like tree, like leaf for the treatment for the people. Then you can see the effect. If the brown things, it's a very big problem. Patient, you see the patient come to the hospital, all the body right. That's big. I'm very surprised as WPA focus to the safety, patient safety for patient. Because I think this is the first priority. I think that we need to your help to bring that information to make something like a campaign, because I am sure that if we don't organize any days or safety days here, and I'm sure that next year we will do it. Because nobody say that we have a post right all safety day information. And this first time I'm there. So I hope we can bring this to our country. And I say that so many programs, but I can bring you to retrieve information.
So awareness. Access was the second point that you said, and third one is awareness amongst the patient community as well. That's, I think, we lack information on that. Dr. Arora. And I would request Dr. Mondar as well, if what you think with an experience, of what are the regional issues as far as your WHO hat is on, what's your perspective on that? So, but Dr. Arora, and then, I'll request you.
We are facing a different problem. The government has made medicines almost free in many states for the thalassemia and sickle cell patients. Medicines are available, but only the problem is quality. See, the medicine that they are there, okay, it's generic. As far as generic medicine in relation to US is acceptable to India. It's protected by good companies and they are not going to worry. They are good. But now we are getting up that we have found that this portal on the website, there any company can register and put their price up and front. So that the government has made a law that any government hospital can purchase from the portal, putting that portal value without tendering. Means that goes the lowest, that is called L1, means lowest value. So when they purchase the lowest value medicine, that is not of good quality. But for when patients are having problems like vomiting, gastritis, and their medicines are primarily for to lower the iron, because maybe blood oxygen releases extra iron in the body. So they have to take medicine daily to take out extra iron. So that medicine is not working. So iron is increasing, and to iron overload, they are losing many patients because of heart failure. So how to cope up that? I want to go to government officials. And if you ask a government doctor, they say I can't do it. If I purchase iron medicine, they will You have some links with a pharma company are being paid and some pricing all these things also. And when you go to corporate officials, they say, we can't do it. Both our medicines are approved by Drug Control General of India, so they should have equal funding. So that should be the different story, but actually it is not.
So what is your concern then? It's the quality of medicine,
Yes, quality. Our concern is quality of medicine.
medication safety, and quality. Yeah.
It's not particular.
Yeah.
See, medication safety may be reactions only, but here medicine is just like placebo. It is not quality. So we are trying our best. Then they say, okay, we can change that your medicine only if you give some trial, some data. And no government doctor is ready to do it because he doesn't have for two different brands. He will purchase only one brand and he is not interested in doing any trial research on whether A brand is better or B brand is better.
Right.
So that is very important.
Okay. So before we go to Dr. Mondar, anything from Malaysia, Indonesia, what you think your experiences are, what patients lack in your communities, And I think, Christine, I would also like, I think you have really presented something, Christine, about the healthcare emergencies. I think that's also a big problem, at least for the Middle East region. I think so. So, if you would like to, say, or do you think it's a very isolated sort of a thing just for Lebanon, or because I think healthcare emergencies for me, I feel it's a big problem. It's this there's a lot of refugee situations in many places. There are wars going on, so healthcare emergencies, I personally feel is another issue. So yes, please. Indeed. Doctor would be later. You first. So we want him to first calm me.
Okay, thank you so much for the opportunity. So, based on the observation, I think one of the most important things in Indonesia is bring up the patient voices, because you see that the patient voice brings significant impact to the reporting and learning and the quality improvement and patient-centered care, and also good outcomes for the patient itself and satisfaction, improving quality of life, and also for the hospital and the health workers. So I think if we bring up the issue to the government, and we have the patient representative at the hospital level, regional level, and also at the national level as policy maker and decision making and the policy level, I think that would be great and bring a significant impact. And the second thing is about whether it's possible to have standardized training for all health workers and in the public country, because I did an interview for medical doctors who want to specialists, and I was quite shocked when there's one question within the interview which asks about what kind of favor that you have done in the last couple of years, and almost 60% of them tell about the medical mistake that they done when they do practice in the hospital. And because Indonesia, it has so many islands, and then we have so many medical schools, but I don't think the quality are standardized. So I'm thinking I don't know whether in the developed country there's a standardized training for all health workers. So I think that also important issue to be. That's all from me.
Okay. Yes, Dr. Mondar, please.
Thank you. So I understand the questions about the challenges.
Yeah, what you as the World Health Organization representative think, are the challenges in the region? What's your perspective on that? It's everything. It's not just patient safety, quality, it's everything.
Yeah, thank you. So as you can understand, the region faces several challenges. Due to several factors. So some of them is related to the fragile situation. So for this I think we have the burden these systems. So when it comes to safety and quality, so as you know, safety and quality is separation. So it's not the end. So most of the time, we say that this is safety, safety or quality is the result at the end. But it needs to be planned, designed since the beginning. What we face is we had, for example, the low awareness about the importance of safety and quality issues. And this needs more documentation, more evidence. We need to generate evidence from different settings. And by using the evidence, we can try to convince and to generalize better commitment towards the patient safety and quality. And as you know, for patient safety, you need a culture that supports what you are advocating for. You cannot force people only by force to do this. You need to have a culture that supports, that understands what the patient safety culture is, that gives the priority to learning from mistakes rather than punishing and blaming people. This needs preparation as well. Based on what we've been doing in different countries, in relation to patient safety, for example, we know that the reporting systems are weak, regardless of the country, still weak, because of the limited country. People will report if you can produce, for example, a reporting system for clinical controls. They will start with reporting on broken equipment. Broken equipment is something that has nothing to do with the state of the patients. And then progressively, as they move with the patient safety culture, they will report the incidents in terms of communication and errors. So this needs like time in order to get this culture mature. So this is something important. Something else that is also relatively weak in our region is the patient and family involvement and engagement. And there is a divide between the patient and family and the healthcare professional. There is like a miscommunication and misunderstanding. From the healthcare professional side, we believe that maybe they are asking to interfere with what they are doing and get the authority. And on the other side, the community, patients, patient representative, there is like the resistance from the healthcare professional. They won't let them to be like involved in the case. For this, there is a need for like bridging the gap. And how can we do that? I was referring to one of the workshops that we conducted in Jordan like 5 years ago, and we invited healthcare professionals and also representatives from the community. And the overall situation was very from both of them. So they didn't understand what we need by patient involvement, patient partnership, and so on. They thought that giving the authority to patients, which is not acceptable, so I will give the authority to patients. So the purpose is to partner and to see how we can produce the care and move together in order to improve this. Because patients, they have a lot to say in terms of safety, to wants to live with disease and no condition. So this, I think there is more to do in terms of like ensuring better communication between the healthcare professionals and also the patients and patient advocacy association as well. Another issue.
So, can I just interfere? So, do you think it's just the matter of communication, or it's more than that? Education, yeah.
They need to get exposed to this kind of new paradigm.
Yeah.
And then they will realize that this is something positive rather than the people affecting that they're going through. So they need to see in practice how this happens. Something else that is also important is the countries, they work on quality, they work on safety from different angles, but they don't have the roadmap, the direction, the policy that involves everyone. So when it comes to, for example, changing the minister and the people change. So you don't have this policy that will last for 5 years or 10 years. So this is something that the NGO, the society, and the policy can work on this in order to get something, regardless of the, I think, the changing of the minister.
So, Dr. Munda, what role can you see in for an organization like World Patients Alliance, to be doing in the region? What role and with whom?
Roles of different the government, for example, when it comes to policy, they need to be very actively involved in terms of providing information on key priorities, having evidence, as you said, contain evidence, highlighting the importance, and I should highlight that also that for advocacy associations, they need to maybe be capable and skilled for how to discuss and how to communicate with decision making, because they don't see things like the others. They need to see the burden, they need to see the cost, they need to see the opportunity cost as well. If I do this, I don't do means that I will have to do another thing. So you need to come up with this kind of, I think, evidence that will tackle the needs. So this is very important at the national level, discussing on the policy, bringing the evidence, and convening meetings and all these things. At the delivery side, delivery of care, in terms of planning, in terms of producing, in terms of ensuring the availability of resources, and also at community level, helping the healthcare professionals when it comes to the delivery of services. And even I was discussing with people from Afghanistan, and I said, what can we do to the community and community representatives in very, for example, fragile settings? And they said that we are able to provide and to ensure the continuity of service. As an example, when it comes to emergency conflicts abroad, you will see violence against healthcare professionals. This is something that we notice. And through leveraging on the community, they will solve this problem. They will be responsible for ensuring the safety of healthcare professionals.
Right.
As a business. So this is these are some tools on what can be done from the society and
Yeah, and I think we would, Dr. definitely request you to involve World Patient Alliance in your regional work, your regional input. If whenever you want an input, through our members, through our main body, I think that will be a good starting point as well.
Yes, yeah, and one last thing to remind about the tools that we are producing in order to advance the patient care quality and that in one of the tasks that we taken forward by the council association is to convert or translate content to these tools
Right.
in a manner that can be easy to understand by the patients, like what we did for the safe surgery checklist.
Yeah.
We have the same for patients. But you as a patient, what can you do in order to take the surgery? And this is that for the priorities.
All right. Okay. Thank you. Yes, Dr. Ken. Now, Ken, you also wore WHO hat as well. Yeah. Okay.
So because I also work with the WHO office, I was supporting scientists in better. And also, so I guess definitely you need to work with the WHOs because the WHO has already existing good resources. For example, traditional medicine, they have already specialized in the development staff who work on the traditional medicine. And also in the Western Pacific regional office, I also work with the physics issue in traditional medicine. As you mentioned that if the people are heavily depending on the traditional medicine, sometimes their diagnosis and treatment was very late. So it's a big problem. So I guess the patient safety issues in the digital medicine is also, I think, a very issue. And also, the medication quality. Also, I guess the WHO has some staff and also the Department of Precision Medicine and quality of medication team also already targeted in the topics among the WHO activities. So you also need to talk about the quality of medication with WHO. Then lastly, patient safety curriculum guide that has been already published in 2011. So it's already available on the website. And in the methodology revision, I try to translate the curriculum guide into the Vietnamese and also some other Asian countries' languages. Because again, the English language is a big barrier in our region. So even for healthcare providers, but not necessarily understand the English. So in order to using the good resources available everyone. So maybe the translation in WHO resources in your languages or in your the local languages, that would be very, I guess, and also in low middle income countries, you should have the WHO office. So the regional office, the working, but also the regional office, not the besides the regional office, I think many of your countries have the WHO country office. So you have the good contact in your country. So again, I think that WHO is a great partner with you. So and WPA actually coordinate the communication, our colleagues here and also the WHO.
Thank you very much. Any last comment? Anything anybody wants to share? Any concern? Okay. So thank you very much. I think it's very, very helpful, at least for me, at least that, to understand what's going on in the region, what our main concerns are, and some of the solutions that we think are there for this, these issues. That now leads us to our next 1 hour session, and that's on the development of the roadmap. So we have, it's been 2 days. We have discussed different issues, and now even the main concerns that we have. So, as an organization, World, Patients Alliance, what can we do? What can we do? There has to be some systematic sort of a manner, some sort of a plan that we need to follow. So, considering that, we decided, to get your input in developing a roadmap, and that we can time to later on, 1 year, 2 year, 3 year, whatever the timeline might be. But we want the key steps in that roadmap that we should keep, so that the organization knows that we have to do this, do that. So it has to be whatever we decide. It has to be something that's tangible and something that's achievable as well for the organization. So I requested Regina Kamoga, our founding board of director, to help us with this session because she already has an experience of having a roadmap developed for the African region. So they had their regional meeting in Africa, and then they developed that roadmap, and now they are working towards achieving that roadmap. So similarly, we want something of a roadmap for Asia Pacific region as well. So before I request Regina to come and talk to you, what I was planning was that once we end up this session with Regina, we could just delay our lunch just very little bit, and we would like to finish earlier today. So what I'm proposing it that after Regina finishes in an hour time, we distribute the certificates that we have for your participation. So we will do that, and then there are at least two groups, I think, that we have thought that they will sit together, even for a short time. One is our skin disease condition areas. You have 4, 5, 6 people. They can sit together and discuss, how can they network, how can WPA help, in the issues they face in the region. And similarly, I requested Makia and maybe Lamia as well, if you have any Arabic speaking people. But I think it's just you and three people. Who else? Yeah, Reed is there. So they're about 4 or 5 people at least. So if you just have maybe very short, maybe 10 minutes thing, just for initial networking and with a commitment to be working together, in the long run, and how can we maybe take it further? Maybe having a meeting or something, online meeting later on, but just initiating the first sort of networking thing. So that's what we're doing. Apart from that, we want to establish a strong regional steering committee. So if you are interested, please let us know that, we already have one, but now after this meeting, we really want to reestablish it, with more people wanting to join. So please do let us know. And so that committee basically meets every quarter, so at least 3 to 4 times a year. And apart from that, also, if you want to contribute towards the conference next year, that's happening 19th, 20th of October in Cape Town, South Africa, in the conference committee, please do also let us know. So not, I think, so it's exactly 1 hour to go. So I request our WPA founding director, Regina Kamoga, to help us develop a roadmap for the Asia Pacific region. Over to you, Regina. Yes, sir.
Thank you very much, Hussein. I think pretty much the work has been done, actually, because the first steps were basically to identify the issues, which we have ably done. And I want to thank everyone for that. Normally, I give flowers. Flowers, everyone. Yeah, so again, the next step in that process is also to develop a steering committee, which Hussein has also talked about. Yeah, so my task has been made very, very easy. And I'm going to work with Edmund, because what we're going to do, we want to be very participatory. First of all, what do we want our roadmap to look like? What is our goal? As this network is supposed to provide us with a strategic direction of what we want to do. Who do we want to involve? Who are the key stakeholders? We need to have a situation analysis to find out what those issues are. Stakeholder analysis. Who do we need to involve? And I'm sure during these 2 days, all these issues have been very clearly stated out. We are reminded by the fact that we all share common problems, and there's no doubt about that. But we are also aware that we have different challenges, but barriers at different levels, which are specific to regions, to countries, even to communities. For instance, I come from a country where you can just walk into a pharmacy and buy medicines without a prescription. You say, oh, I think I have diabetes. What best medication would you give? And the pharmacist will, with no fear or shame, will just say, oh, these are the ones that I have. One time I traveled to the UK because of lack of quality medicines in my country. I wanted to stock so many paracetamols to take back to my country. But at the counter, I had all this batch of Panadols, and I was told you can only take only 3. So you can see the difference. We have different levels of the healthcare system in different countries. The pharmacovigilance systems and the regulatory systems are all different. So we are very much aware of all these. So that is the very reason why we are developing an Africa regional roadmap, as well as right now we are at the stage of doing the implementation plan, which includes the strategic object or outcomes, the activities, the responsible people, the resources. Dr. Monda actually gave us so many resources, as you could see from his presentation. We have the Global Patient Safety Action Plan. Dr. Shin also has a lot. Lamia, they all have a lot, and many other presenters we have had. All these are resources we have to harness. We need to leverage resources through collaboration, because we know that together we can move faster. In my language, we say, agali awamu gegalume nyama. This means that teeth that is together bites the meat better. So we know that as we're here, we can bite the meat better. So without further ado, I want to invite my colleague Edmund. We've had a discussion about this and how best we can have this session more participatory. We've already identified the issues. And if you have, in my country, we say, akatalekeka, something that you cannot leave. We have talked about the challenges, the barriers, but if you think that there's something that has not been highlighted, because we're going to look at the different issues and we are going to pick out those that we think we can focus on, because we're going to look at the short-term outcomes we want and then the longer term. Shorter term can be 1 to 2 years, longer term can be 3 to 5 years. And I think in this meeting, because of lack of time, we are going to focus on those strategic outcomes we want, and then we can take it from there. The steering committee has a big role to play to ensure, because at WPA, we say NATO. Who knows what NATO is? Anyone knows what NATO is? No action, talk only. Yes, sunflowers. So we don't want to be NATO. We want action. So we want a committed steering committee to drive this. From this roadmap, we want an implementation plan. But like Hussein said, it needs to be realistic. It needs to be achievable. We know all those issues of being smart and everything. So that is what we want to ensure, that we don't just come here and sit in a meeting for 2 days. We enjoy maybe Dubai and stuff, and then we go back home and nothing is done. So WPA is committed, and that's why we're putting priority on regional strategies, regional activities. So we identify our real issues. The issues that affect us are specific, are culturally sensitive and sustainable, so that together we can make a difference. So I want to invite Edmund to guide on how we're going to do this, to ensure that we don't take a lot of time, but we come up with what we think can work for all of us.
Thank you,
Thank you.
Thank you, Regina. Now, how many tables do we have right now? 1, 2, 3, 4, 5. Can I include 5 tables? So what I do is, can I invite just one representative? Use your phone, take a picture of this, and then go back to your table. And then every one of you just take a picture, and then you are given 5 minutes to line up 3 short-term, 3 mid-term, and 3 long-term goals according to your table. So the objective is we will gather all this information together, and then we will look at which are the consensus, long, mid, and short-term goals. And then after which we will continue to the next step, which is the milestone. All right, everybody, you all right? So please send one representative, guys. Just 5 tables. Just come to the front quickly. Come on, just take a picture. I don't need everybody to come. Just one person. Come on, guys. Just one person. Yes. Thank you. Thank you. Come on, guys. 1 minute. 1 minute. 1 minute. Yes, you have 50 seconds left. Yes, don't have to do a catwalk. Yes. Yes, just do your best. Yes, we don't need the best phone in the world. Thank you. Yes. So after that, put your phone on the table, and then your team members, please snap 2 shots. All right, the left and the right discussion. Okay. That's right, that's right. And then you are given 5 minutes, ladies and gentlemen. All right. Later on, we'll get them. Please write down on a piece of paper. Write down a piece of paper, maybe 10 minutes. Yep. All right, write down a piece of paper. I repeat again, short term. Short term means any plan that is less than 1 year. All right. Mid-term means any plan that is between 1 to 5 years. Remember, long-term, of course, any plan that's more than 5 years. Thank you. All right. Okay, let's go. All right, your 10 minutes starts now. Yeah.
Yeah, but we need to ask them if they want that. I mean, that's voluntary. Yeah. Online. Yeah, so but you just ask them. We have something here. So it could give their mobile. No, they could give the mobile numbers to all the staff, and then we can just look at the account.
All right, if any one of you want to join WPA as a member, and then you'll be in your WhatsApp chat group later on, please forward your number at the front desk. Thank you. All right, guys, 9 more minutes. 9 more minutes. Short, 3 mid, and 3 long term. Thank you. And please write down on the piece of paper. Thank you. Ladies and gentlemen, you have 6 more minutes. Thank you. All right, guys, we should start writing right now. Remember, you have 3 more minutes. Thank you. We just need 1 piece of paper from each table. Thank you. All right, 2 more minutes. Come on, guys. Start writing. All right, 1 more minute. Come on, 1 more minute. Just write something, guys. Even though you don't have 3, it's okay. At least 1. Thank you. Come on. 60 seconds starts now. All right, guys. Okay, stop. Enough. Thank you. Now, I've just given to every table a marker, right? Okay. All right. Now, can you swap your paper to the next table, to your right? Swap your paper to the right. Come on. Can we have someone assist them? Any assistance? Yep, help them to sort to the right, clockwise. Or waiting, okay, waiting. Okay, that group have to go to the first group, the piece of paper. Okay, swap. Somebody help them. If you're ready. Yep. Just bring it. To the first table. Karen, to the first table. The first table, yeah. Just pass to them. All right, the first table will bring it to the second table, and the third table will give it to the fourth table. Thank you. Yes, just swap. Somebody just help them. Yeah. Yes. Yep, swap. Give it to the right. No, correct. Yes. And then yours over there. Boleh? Okay. All right, it should be done easy. Yeah, just change. All right. Okay, listen here, guys. Remember the marker which I've given to you, right? The marker. So what you do is, based on the piece of paper in your group, I need your consensus for short term, mid term, and long term. Out of the three, all right, for short term, which one is more important to your group? So the one is more important, you put 1. All right, the less important and the least important. All right, for short term, mid term, and long term. Okay, thank you. Please use the marker which I've given to you. Just prioritize. All right, on the piece of paper, remember you have 3 short term, 3 mid, and long term. So for short term, which one is more important to you? You put 1. Less important and least important. The same thing goes to the mid. Yeah. 1, 2, 3, 1, 2, 3, 1, 2, 3. All right, for your group. No, it's okay. Later we'll tabulate. All right, guys, you have 5 minutes quickly. Come on. That's an easy job.
Yeah. It was meant to be. But only one. Oh, yeah. So
Ladies and gentlemen, listen, please listen here. Seems like there's one or two groups, there's only one option given for each of this short, mid, long term. It's not good enough. So what we do is we'll roll back the piece of paper again. All right. For those groups who has only given one option, please add two more options for short term, mid term, and long term. Don't worry, we still have time. Please roll back that piece of paper. All right, for those who have done already, it's okay. You can always add on if you want to. I'm fine with that. Can at least three, guys. Yes.
They listed several, but they didn't say which one is low, medium.
Which group is that?
I don't know. I think the last table. There's no low and medium.
All right, remember to make reference to the two pieces of paper here which you have contributed. You don't have to reinvent the wheel. All right, thank you. All right, let's do it in 3 minutes. I believe this will be an easier task. All right, 3 minutes. Come on, guys, one more minute, quick, one more minute, one more minute. All right, everybody, seems like everybody is done. So what you do is, as usual, can you switch your paper in a clockwise direction? All right, in a clockwise direction. Okay, just pass on to your next table. Come on, guys, let's pass on. All right. Okay, just pass on. Yep, yep. That's right. Okay. Thank you. All right. So as usual, for each of these short, mid, and long term, rank them. All right, using the marker which I've given to you. Thank you. All right, 5 minutes, very quickly. Thank you. Very good. All right, 3 more minutes. Come on, 3 more minutes. Easy. Just use the marker and list them down. All right, out of the 3, which one is more important to your group? Just put 1, 2, 3 for each of this short, mid, and long term. Easy. All right, can I have a show of hands? Which group has done? 1, 2. First group, done? Done. Third group, done? Not yet. Lakas.
So that's why. There's a lot of ladies here. Yeah, you may yeah, next 15 years.
Okay. Okay. Very good. Yes. Switch your paper again to the right. Yes. All right. Switch the table. Yes, I know you guys are very serious. This is a very serious topic. Yes. Fantastic. All right. Now, the next thing now, again, use the same marker on your table. All right. No. The other way around. You give to them, Karen will give it to the first group again. Same thing. No, this piece of paper is yours or not? The first one, yes. Thank you. Yes. All right, 5 minutes, guys. Come up with 1, 2, 3 again. All right, come on. 1, 2, 3. For short term, mid term, and long term. Thank you. All right, I want to hear from every group what is important to you.
Right, then they get positive, right? What? Continue number one. Agree? And then policy number two. Thank you.
All right, guys. All right. One more minute quickly. Come on. All right. Remember, short, mid, and long term. Same exercise. All right. One more minute. One more minute. It's okay. It's okay. Do it. Do it. Do it. Do it.
Okay.
Armstrong. All right, guys. If you're done, please move on. This is the last round. All right. Pass on to the next table. All right, the final round. And I need your help to tell us what will be your top 1, 2, 3 for each short, mid, and long term. Thank you. All right, let's work a bit harder. Thank you. Again, 5 more minutes. Thank you.
Medical insurance. Okay. Okay, number one. Number two. That's neuromet. Number one is one. What is number two or number one? Number two. 1, 2, 3. One in the middle. And number two. And then for the middle one, GP. When you have the maybe the gap We have no. And then another one. Data policy, and then protection, unfortunate fact, and the medical. Yeah. So I think the number one is and then policy. Yeah. Yeah. Number one, and then number two policy, and then number three is okay.
Very good. All right, guys, for those who have done, can you please pass the paper back to the front? And then we will do the tabulation. Yeah, come, bring it here. Thank you. Or we do the tabulation.
Six. Six now. Now six in Malaysia and Indonesia. Five.
All All right, ladies and gentlemen, thank you so much for your collective effort, my dear friends. Now, we have done our tabulation. So what we do is, our dear friends will help me to write down for short term, what will be the group consensus, most important item that we're looking at. Number one is, of course, the short term will be about collective voice and surveys. Collective voice and surveys. Okay. And then midterm, we're looking at good advocacy practices. Good advocacy practices. And quality training. All right, then let's go to long term. Thank you. Long term. Integration of international policies to national policies. All right, done? Fantastic. Thank you so much. Everybody, please give her a round of applause. Thank you. Thank you very much. Now, as usual, each table, please choose one member to come out, take a picture again on that piece of paper. And the last thing that we do is, please write down the goal and strategy to achieve the short, mid, and long-term goal. That's it. Can everybody? All right, come, just choose one member. Come forward, take a picture. All right, and then your table, your colleagues will discuss about the appropriate goals and strategies to achieve the respective plans that we have just came up with. Thank you. All right, come on. All right. Yes, let's take a picture and then go back to your table, and then after which come up with a goal and strategy so that this will be integrated to our milestone to be achieved. Thank you. All right, you have about 10 minutes to finalize it. Thank you, guys. Come on, let's do it. Yes, there's no homework. You do it now. Yes, goals and strategies. All right, you know this is the aim, right? This is the aim for short term, mid term, and long term. Thank you. Write as extensively as possible. Thank you. Yes, please write on a new piece of paper, of course, yeah? Short, mid, and long term. Write as extensively as possible. Thank you. All right, guys, it's feeding time. Come on, 3 more minutes. Thank you. I have one group has completed already. Fantastic. What about you? Come on.
Baseline, next baseline. Yeah. No, we need to our country, get our country. The first time, we have to get everything. Another one. And then number three is analyze, okay? Analyze.
Yes. All right, guys, come on. 2 minutes, strictly 2 minutes. All right. I know you're finishing already. You had a long term. All right. Thank you. We need all your feedback, which is very crucial. All right. When we come up with our own milestone. All right. Thank you.
Quality training. Yeah. I make more to signing.
Really, really. Do your best, do your best. All right, I can see your last sentence. 1 more minute quickly. Just wrap it up, guys. Yep, we have to wrap up the whole process. Thank you.
Okay. And then number two. Number three. Okay. Make long term. International policy. Wait. One. Make the curriculum. International policy to national. Number one is curriculum. Okay. And then number
All right, guys, thank you so much for all your cooperation. All right. So I think we should now proceed on, and then all your contribution will be tabulated by the board of directors, and then after which will be a good roadmap for every one of us. Give ourselves a round of applause again. Come on, guys. Thank you. I'll pass the time back to the organizer. Thank you. All right.
Thank you very much for your hard work. Extremely grateful, and it's very beneficial, I'm sure. So what the next steps are, we have all of these recommendations, suggestions, and everything. So we will finalize this roadmap. So I will request admin and Regina to help me, and we finalize this roadmap, and then we'll share it with you. The other thing is this: we are forming this WhatsApp group. So all of the people in this meeting, please give your mobile if your numbers. If not, if you want to become a part of that WhatsApp group, so that's going to be there. So we'll definitely, that will really help us in keeping in touch with each other. Again, if you want to be included into the steering committee of the region and the conference committee for next year's conference in Cape Town, South Africa, please give your names to Rehan and Haris. So we'll get back on that. And before we just want to finish. So we want to thank our sponsors for this conference, our silver sponsors Pfizer and Sanofi, and our patron level sponsors IFPMA. Without their help, this meeting would not been possible at all. The last two things. So we'll just now, distribute certificates of participation now. So I'll request a few of our guests to please, distribute certificates to all of us. So that's one thing. The other one is one thing that's left is our networking meeting. But I think the networking that we just did is quite enough. But if we have groups like skin diseases, or we have Arabic speaking countries, I think what we can do is we can again reach you out after the meeting and maybe hold an online meeting so that we can continue our discussion in our in our own areas, specific areas as well. So thank you very much. Have safe flights back home. But now, last thing is the, sorry? Sorry? No, 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 no. So we will distribute certificates to people in front of the flag. So I would request our board of directors and our advisory board members, both elected as well. Can you please kindly come onto the in front of the banner? Engi, can also please come. So yeah, if you could, Dr. Arora, can you please come onto the banner? So our advisory board members. So we would start distributing the certificates. I would first request Dr. Monda to give certificates to some of the people. Then I request Dr. Shin, Dr. Ken, and Lamia to please distribute certificates to few of the people. So Jolanta, you will speak out the names. So 3-4 people Dr. Monda can give. But I want the advisory board members to be standing next to me. Don't want to do this. Yeah, they're over there.
Still, it is still there. Thank you.
So next person is Akya.
Can I have a request, Regina?
Now, James, honey.
I think it asked to do this one. So, we have one person. Yeah. Yeah. everybody.
Hi everyone, the meeting has been closed. Thank you very much for your participation.